I'm a senior in chemistry and math, and I've been a part of the Randall Research Scholars Program since my freshman year, and that's really been like the most defining part of my time at UA. It involved coding classes starting early, and it got me involved in research really early, which has definitely defined both my time here at UA as well as my next steps going forward. I didn't think I would very much like research. I definitely didn't think I would end up applying to grad school like I am now, but being exposed to the research process so early on and supported through that has definitely changed my time here. I'm really grateful for the opportunities to do meaningful research like I have.
And I think what's really incredible in terms of what the research that she has done with us is that for most of the times for undergraduate research, the projects are designed in a way so that somebody could come in and do something very routine and not necessarily intellectually contribute. And I think Abby did not want that from the very first day. She always wanted to make sure that she knew what she was doing, why she was doing it, and how she could add to what we were doing, and which is exactly what she's been doing for the past couple of semesters. She's basically spearheading her side of the research, which is typically what I would have a grad student or sometimes even a postdoc kind of do, but she has kind of taken it on herself and been really a leader in the lab.
So much of what Alzheimer's disease isn't understood. Everybody knows someone who's affected by it, but we can't tell people what made them get sick or why they're sick. We have theories, we have hypotheses, but we don't know why. And so what we do is we take postmortem brain tissue samples and we study them with infrared lasers, and we try to determine the chemical composition of the plaques of proteins that build up in the brain. We know these plaques cause Alzheimer's or are associated with Alzheimer's, but we don't understand what they are and how they form. So by trying to elucidate the actual composition of these plaques, we're trying to reverse navigate a mechanism for their creation and try to understand better the chemistry behind what happens in the brain for Alzheimer's disease patients. And we're working closely with pathologists and other universities around the country with samples and other consultations to better understand the development of Alzheimer's disease and different microenvironments and chemical compositions of the plaques. So I'm pursuing a PhD in biostatistics next. I'm really excited to get into an analytical approach to healthcare and disease epidemiology study, and I've also recently discovered medical anthropology as a well-rounded approach to medicine and biomedicine as a whole, and I want to be able to keep that up in my PhD coursework to be able to do research that contributes to the growth of human people and take both my analytical skills I've worked so hard to create as well as a new approach to medicine and public health.